All right, welcome everyone. I'm Bethany Hamilton with the National Center for Medical Legal Partnership. I'm going to get a PowerPoint here to share. So to welcome everyone here to today's webinar. All right, if I can just get confirmation from our team here at the National Center that our screen is sharing properly, we'll roll right in. Thanks, Danielle. All right, so thank you everyone again for joining us. You have joined today on a very important conversation hosted by the National Center for Medical Legal Partnership. And we're joined by some very special guest panelists who are subject matter experts, all from Texas, who will be presenting on how, for those of you in the health center audience today, how you can really leverage your health center medical legal partnerships to advance community-oriented policing efforts. Today is September 30th, 2021, 2 p.m. And this webinar is supported by HRSA. So first of all, just in case you can't really hear us properly, some quick housekeeping. Turn up your volume and make sure that you address that as your tech issue first. If you do have any trouble still hearing us or seeing anything on the screen, just go ahead and use your email or the chat box, and you can send an email to aprildaniels@gwu.edu or pop a message in the chat to let us know that you're having some trouble. You'll also, because you've all been joined by default on mute, please use that chat box to submit your questions and comments to today's panelists. As I mentioned at the top, this is sponsored by HRSA. The National Center for Medical Legal Partnership is a national training and technical assistance partner, providing technical assistance and training to health centers around the country on how they can advance and grow medical legal partnerships. As a part of that work, we are required to survey you at the end to make sure that this met your needs, your objectives, in terms of learning. And we want to make sure the content and our panelists, they want to know, was it good? Was this helpful? Was this helpful? Do you want to see it again? Don't worry. Yes, it will in fact be recorded, and we'll be sending out an email to follow up with both the link to the recording or when you can look forward to receiving the recording, as well as the PowerPoint slide deck. Again, I'm Bethany Hamilton, co-director of the National Center for Medical Legal Partnership, and I'm just going to go over some quick introductory remarks. For those of you who may not be as familiar with us here at the National Center, our objectives and goals really are to transform the focus of healthcare and civil legal services from moving from just people working with people or individuals to entire populations, or we're transforming population health. We aim to build and inform the evidence base to support the medical legal partnership approach, and we ultimately would like to redefine interprofessional education with emphasis on training healthcare, public health, and legal services professionals together. For today's webinar specifically, what we're hoping we will help to achieve for you as the audience is better understanding this definition of the medical legal partnership approach. If you've tuned into our webinars in the past, some of this will sound familiar. I'm just going to do some level setting, however, for those who might be new to one of the National Center's webinars or understanding medical legal partnership. After I go through those brief overview remarks, I'm going to kick it right over to our guest panelists today to really help everyone understand, especially coming out of last year and every year that we've encountered this social justice movement around police brutality and violence, and really wanting to improve community policing and public safety efforts. They're going to help you understand why community policing matters for health. They're also going to help you understand how your work at health centers and at MLPs really intersects with public safety approaches. And then finally, they're going to provide for you some concrete strategies for engaging in community-oriented policing initiatives that affect the health and well-being of the communities you serve. So our guest panelists, these really are your subject matter experts carrying out the work on the ground in the field every day. And we're so happy to be joined today by attorney Keegan Warren Clem. She's with Texas Legal Services Medical Legal Partnerships. You've heard her on many of our, not just our webinars before, but if you've attended the National Center Summit, you've probably seen her at the summit on panels as well. We also joined by law firm partner Rachel Rezabek with Kirkland and Ellis LLP. And then finally, Stacy Lofton. Happy to have Stacy here with us from the Harris County Public Health Department. Stacy's also an attorney. So we're a panel full of attorneys, but you do see that we have a mix here of MLP, private law firm as well as public health. And so we are very grateful for the time that these women have taken to really help us learn how we can advance medical legal partnerships and address public safety efforts that are underway. So first, the definition. For those that are completely brand new, or maybe really need to just say, wait a second, how do we define this thing? Because we're about to talk about community-oriented policing, and you've been most familiar with civil legal services being the L in MLP. Let me redefine MLP for all of us and help us remember, just level set and remember what we're aiming to achieve here. So medical legal partnerships really are an intervention where you bring legal and healthcare professionals together to work, to collaborate and work to address the patient's issues and problems and needs in the social, economic, and environmental categories, those SDOH factors. Those are the factors that we know contribute to the health disparities that we see, and oftentimes have those remedies in civil law because they are social needs with legal underpinnings. Around the country, we see over 450 health organizations in 49 states and DC running medical legal partnerships. Soon, this table will add Puerto Rico to the bunch and ensure that all of our territories, we're accounting for MLP work going on in the territories. But for both health centers and non-HRSA health centers, so those lookalikes, you are representing the fastest rate of growth. And as you can see, a huge chunk of the pie for MLPs around the country. We're focusing on patients to policy work today, but I wanted to just quickly explain that what lawyers in medical legal partnerships do when they're embedded as members of the healthcare team really is a range of activities, starting with, of course, what our minds default to, which is direct legal assistance to address those patients' social needs with legal underpinnings. But we also see in that spectrum of activities that MLP attorneys do, and the legal teams in general, includes training, clinical level changes, and what we're going to talk about today, which is a policy level change. Ultimately, this work amounts to changes such as healthier patients in the communities. For health centers, you will become a stronger health center workforce because you're able to practice at the top of your licenses or your certifications, really getting your work done, because now you're able to finally have a workforce, the legal community, address patients' needs, and then finally improved health outcomes. All right, so I'm going to turn it over to Keegan Warren Clem, our first guest panelist for today, and she'll be running a poll first. Keegan, let me know if you'd like to go ahead with the screen share to your slides, and I'll stop mine and we'll launch a poll. And thank you.
I think we can perhaps leave it.
Okay.
Yeah, leave it out with you sharing.
Sure. 1 second. Okay, all yours.
All right. So we wanted to get things started by establishing a bit of a baseline. And so we're asking you, to what extent do you agree that a community's relationship with law enforcement affects the health of patients? Give you just a few more seconds for the last few folks to weigh in. Looks like we are with 82% in, somewhere between neutral and dominantly strongly agree that a community's relationship with law enforcement affects the health of patients, right? 20 of the 33 people who answered, 61% strongly agree with that statement, 36% agree, 3% are neutral. But I want to talk about why we think that a community's relationship with law enforcement matters for health and how it can present in the delivery of healthcare. Thank you. In the wake of the murder of George Floyd in May 2020, we saw many racial and social justice protests like the one pictured. We saw a proliferation. We also saw that these protests were often heavily policed. And so it wasn't a surprise when our medical legal partnership legal team received its first referral for a patient who alleged his injuries were the result of police brutality. And we gave the man a warm handoff to the impact litigation team at Texas Legal Services Center. And it turns out that wouldn't be the last such referral to that team. Months prior, though, another familiar referral came in. I think if you can go ahead and advance to the next slide. This was a new, it's doing something very odd. I'm sorry. Could you, apologies. Can you go back?
No, let me apologize, Keegan. I'm trying to bear with us, y'all. 18 months in, and I still can't get the virtual
hard.
Space to work for us.
Yeah. Okay.
So Keegan,
okay. I'm sorry. I think we're good.
Trouble with the animations.
Yeah, no worries. Months prior, we had gotten another familiar referral that would become familiar. This was a new mom with a febrile newborn who had called to cancel the infant's appointment because there were rumors of a possible ICE raid. And there was little we could do to reassure her or even to get the baby access to much needed care, but the pediatrician was able to give basic medical advice over the phone. Now, what these two stories have in common is that they both demonstrate ways that law enforcement can impact the delivery of healthcare. In the first, we see avoidable utilization of medical services, and in the second, inability to access care. The health outcomes for these individual patients led us to wonder how communities across the nation fare as a matter of population health. And we're not alone. In a pre-publication report released just this past Tuesday, 2 days ago, the National Academy of Medicine, right? The National Academy of Medicine wrote that, and I quote, "An evidence-based approach is needed to guide policing reforms and interventions aimed at promoting the rule of law." And so our MLP sought partners to help us move from patients to policy. Now I'll turn it over to Rachel to tell you more about the pro bono partnership between the public interest law firm, Texas Legal Services Center, and our medical legal partnership department, and the private law firm, Kirkland and Ellis.
Thank you so much, Keegan. And thanks for having me here today. So it was about a year ago that Texas Legal Services Center came to Kirkland and asked us if we would like to do a pro bono project with them. I was pretty new to the firm at the time. It also just fortunately, made partner and had, in transitioning to the firm, wanted to continue with work I'd done at my previous firm and be really involved in a pro bono committee and pro bono work. And so one of the very first things that was brought to me was, hey, we have this really great idea for an opportunity with the Texas Legal Services Center. Do you want to, now in this new pro bono role, would you maybe want to run with that and kind of take ownership of it? The first step there was to say, well, sounds amazing, but let's find out what it is and see if there's interest. And so you got on the phone and understood that the project related to a campaign called 8 Can't Wait, relating to policies in place that we want to put in place relating to the reduction of the use of force by law enforcement officers. And the specific ask of us was, with respect to 2 of those 8 policies, specifically de-escalation and warning before shooting, what already exists in the law relating to those policies in all 50 states? So I took that back to Kirkland and kind of sent out feelers and asked people if they were interested in participating in a project like this. And the response was candidly overwhelming. We got so much interest from our attorneys, from the most junior associates to senior partners, who said absolutely. Not only was this something that we were kind of seeing in the news all the time, that obviously enacted a very visceral response. It was also a really amazing opportunity, being a kind of 50-state survey, to be able to break up little pieces for people who, in unprecedented times, we all have very different demands on our time and all these sorts of things. for people to say, yes, I can help, and I know that I'll be able to participate in this, and it's not, litigation that's going to go on for years and years sort of thing, and I can, have this really, this impact and help promote something good in something that seems digestible in a way that at the time, I think a year ago, it was chaos, right? So we adamantly said yes. And from there, we kind of deployed the troops. And I'm happy to talk really quickly, granularly about how that worked. But basically, in short, we worked with the Texas Legal Services Center to make sure that we had a template from the beginning. This is how we think this should look. This is the way we would present everything to you, and we'll do it, in Excel sheets, and to make sure that we were providing work product that would be helpful to their team, that was what they wanted. And we just kind of went from there and created this 50-state survey that identified either the existence of law and policy and procedure relating to de-escalation or warning before shooting, or, candidly more often, where that didn't exist for a state, and package that up, in a bunch of materials and handed that over to Texas Legal Services Center. And, I know that the rest of the team will talk more about how that looks today. We, I think, as a Kirkland, as a firm, are so fortunate to have been a tiny little part of something that, candidly, it looks pretty impressive, thanks to the work of the women on this panel. And I think that covers it.
Thank you, Rachel. And we are so grateful to have gotten the opportunity to work with you all. But thank you for that explanation as well. And we're going to leave, I think, plenty of time for questions. So if anyone has would like more details in terms of how we created this relationship, because it's not what pro bono partnership normally looks like, right? That we very often in pro bono think about individual cases, and here we really mean for one of the pragmatic takeaways to be there are other ways to think about using these incredible skills that we have as attorneys. So with that information, with this spreadsheet that was enormous, it took a special file transfer, in fact, and not just an email, because there was so much information that the Kirkland & Ellis attorneys put together. We wanted to do something with it. We wanted to make it much more digestible. The best vehicle for that seemed to be our Texas Medical Legal Partnership Coalition. So TLSC MLPs, our specific medical legal partnership department, are members of this larger statewide network. And this network is made up of MLP practitioners, but also other interested professionals in health and medicine and public health across the state of Texas. Now, the coalition has formalized standards and guidelines for Texas MLPs. But with representatives across all of these fields, one of our stated goals is to advocate for health affirming laws and policies. And so again, this seemed like the appropriate vehicle for taking this really complex and amazing database and turning it into something more digestible. So this is the not just the website, but it's actually the landing page for this project. And I'm very excited to launch it officially today. It summarizes the evidence base very quickly, very succinctly for understanding this topic as a matter of health. Now, Stacy is going to talk more about how law creates an evidence base for health in just a moment. But I want to show you the web pages that we created. Now, the first thing I would say is I would echo what Rachel said. We didn't seek to recreate the wheel. We can't be experts in everything. So instead, we looked at this framework that was proffered by experts, and specifically by the 8 Can't Wait campaign. They advocate for police departments to adopt force restrictive policies. Our goal was to understand, again, how 2 of those policies exist in state law, whether it was regulation, statute, or common law. I think we actually ended up tackling 3. The research was so thorough. Next slide, please. So there's 3 primary pages. There's sets of maps. The first concerns statutory de-escalation training requirements and definitions. And for each of these, you get the definition and kind of how it's understood as a matter of population health on each page. I've pulled the maps off the page just to make them a little bit easier to look at. But you can mouse over each of these and it tells you what category it's in. And then if you click on that page, it takes you to a state-specific page that describes, in this case, training requirements and statutory definitions around de-escalation. Slide, please. We also looked at warning before shooting, again, definition, a dearth of training requirements written into law, as it turns out, and not a lot of definitions either. Here again, you can click on any state that you are interested in and go to a state-specific page that shows you what the applicable law is, where it exists. And then there's a third set. Next slide, please. That really came out of looking at these other 2. There was kind of a collateral set of laws around use of force, and specifically around the continuum or the matrices that may exist in law, and whether there are training requirements for those, and then whether that continuum or matrix is defined. So same setup where each state provides, clicking on any given state gives you the law that shapes it. All right, there is a 4th set of slides, what maps. Next slide, please. Because what we found is that there's always common law that may offer some clarity on the definitions, on the requirements, and then there were also policies written, guidelines that existed at the state level, because that was our focus, not at the community level. There are lots of resources, it turns out, for understanding this at the community level. And so you can click on any state and it will take you to a state-specific page. This map is not color-coded because this is really just about making it easy to get to each resource. We're going to turn to Stacy now, for an overview of how partnering with the public health sector can help leverage this kind of legal research. I think what Stacy has to say is really important because we talk about medical legal partnership, and public health is naturally part of that conversation. Stacy?
Indeed. Thank you, Keegan. So as Bethany mentioned at the start of this presentation, I work at Harris County Public Health. I've been in public health for over 15 years. And since March of 2020, I've been activated to respond to COVID-19 in Harris County, leading COVID-19 equity and resilience initiatives. And so just as many of you saw, low income and people of color were disproportionately impacted by COVID-19, as well as food, housing, and economic insecurity, right? And COVID-19 only served to highlight what many of us already knew, that health, racial, and other social injustices have long existed, right? And have persisted despite many of the interventions implemented at the public population level, as well as the individual level. And so the coalition understood the magnitude of the persistent health inequities that we see when we formed over 3 years ago. And so as a collective of MLPs, we wanted to really leverage the law to address, if you can proceed to the next slide, Bethany. Thank you. So as a collective, we wanted to leverage the law to address inequities experienced by clients and advocate for change for individuals and more broadly, as Keegan mentioned, for communities, for the populations that are similarly situated to the clients that are served by our MLPs. And so our position as attorneys and public health professionals really equips us to address these injustices that we now see vividly, right, during this epidemic. And so, as you can see, our chief aim is to transform the health of all Texans by addressing the structural problems that underlie these health inequities we see, and also the structural problems that contribute to the health harming social needs, often referred to as social determinants of health. And so we were really intentional about designing the logo. I want to point that out. You see the roots, and that's really about emphasizing the vital role that the root causes play in creating these health inequities. And what are the root causes? Next slide, please. So for the most part, right, discriminatory laws and policies, many of which are and were blatantly racist, right, are at the root of inequitable access to opportunities, the goods, the services, the resources that are so vital for health and well-being over a lifespan. They are the driving force, as this image depicts, of the outcomes, right, the racial inequities that we see in health, in housing, education, transportation, all of our systems. And in her article, Barbara Reskin, she really nicely explains and well depicts this system, this race discrimination system. And she particularly highlights how laws, policies, and regulations created, maintained, and exacerbate racial injustice across systems. And these are the very same systems that drive health inequities. Next slide. So given their function, MLPs are inherently well positioned to address these structural root causes of health inequity. The health harming social factors such as housing insecurity and other social issues facing clients and communities. And so our MLPs, right, they inherently pursue justice and seek to remove the barriers to health and well-being. And I like this diagram to the left, to my left, because it really depicts what liberation is, right? We all pursue equity, but the end goal is justice. The end goal is to remove the barrier, not to only ensure that people have what they need, but that there aren't any unnecessary barriers preventing, right, health and well-being, or preventing an individual from achieving what it is that they'd like to achieve in their life. And I also like this diagram because it shows that the reality is most minoritized and marginalized populations don't have what they need to achieve their fullest health potential. And also they're so inundated by social burdens that they aren't even in a position or on solid ground, right, to even begin the pursuit of health. And so I like the diagram for that purpose, but then understanding what MLPs bring, right? How MLPs essentially contribute to the liberation of communities, right? And how they pursue health justice by addressing legal needs, right? And in their efforts, our efforts, essentially remove the barriers, right? And that's why we focus on liberation in our pursuit of health justice. Thank you. So as MLPs work to address the various legal needs associated with a client's health status, they inevitably have access to health data, as well as legal data, right, associated with the MLP's practice. And these data sets can be analyzed and linked to better understand trends occurring at the population level in communities, and to identify injustice experienced by particular groups. such as tenants within a particular apartment complex. And so in meeting legal needs, our coalition realized that we had access to data and grassroots mobilization in order to support legal reform, right? Changing those laws that drive health inequities and transforming health outcomes by implementing health supportive laws and policies. And so with that, next slide, please. We wanted to make the connection in a formalized and methodical way. And we turned to our partners at the CDC and at Change Lab Solution to really help us understand the approach that we should use, right? And they explained to us the concept of legal epidemiology. And we began a partnership to learn and apply legal epidemiology using some of the data that we discussed, the police de-escalation data and other data sets available to the public health department in Harris County. And so just to kind of give you all an overview of legal epidemiology is the scientific study of how laws and policies impact public health. Right? It's a formal way to observe and measure how law or policy create, perpetuate, or exacerbate inequities. And it also allows you to compare any differential impacts of laws as they are enacted and implemented across jurisdictions and over time. And the manner in which laws unfold in the US, varying across place and time, it allows for this natural experiment, if you will, right? So public health practitioners and attorneys alike can establish causal inference between laws and health outcomes using this method, legal epidemiology. So when we look at legal epidemiology and apply the methods to the issue of law enforcement violence, we realized that there was a significant need, right, in Texas to address this issue. And the American Public Health Association declared law enforcement violence to be a public health issue, a critical public health issue. And here is some health data associated with law enforcement violence. You can see that there are inequities, right? People of color accounted for more than 50% of years of life loss due to the intervention of law enforcement. And they only accounted for 40% of the population. So that expresses a disparity, right? And then the correlation between the deaths of Black individuals due to law enforcement and subsequent poor mental health among Blacks living in the same state. So we see impact to physical and mental health as a result of law enforcement violence. And then legal scholars have described a clear connection between the increased exposure to stops, right, law enforcement, police stops, and an elevated risk of death or physical harm by law enforcement officers. Next slide. So we wanted to apply legal epidemiology to understand what the individual and community health impacts of police de-escalation training. And then secondary to that primary research question, we wanted to understand how police de-escalation training is implemented, practiced, and enforced across jurisdictions within Texas. And we also wanted to understand the various organizational policies and practices, such as community-oriented policing, that would influence the implementation of police de-escalation training. We also looked at the governing law, right, requiring officers to complete statewide police de-escalation training, as well as a general statute that kind of defines the instances where the use of force is justifiable. And so in looking at the law, as well as the implementation of these laws, we're reviewing how these laws are implemented at the local level, right? So this is, we're looking at Harris County, a couple of counties and a few cities within the state of Texas to see if there's any difference in the implementation and how that impacts health outcomes. How does that impact police community relationship? How does that impact the mental health of individuals within those particular jurisdictions? Next slide. So legal epidemiology is a critical field of scientific research. Ultimately, it helps us identify the status and understand the trends of public health laws. They help us determine whether a law influences health outcomes and or social determinants of health. Help us also to build evidence, right, in support of the design, implementation, and diffusion of legal solutions. All right, if police de-escalation is effective in preventing a loss of life or disability as a result of police civilian engagement, then we need to ensure that police de-escalation training is implemented in a particular way, perhaps across the US, right? We can ensure that that particular solution is replicated to protect the health and well-being of individuals, right? And lastly, it can inform policymakers' public health related decisions. We want to always provide, right, an evidence base for the development of laws and policies and make sure that those laws and policies are actually working for the people and then evaluate them. Next slide. So here I've listed a few resources. You can take some free trainings on legal epidemiology at CDC's website, as well as Change Lab Solutions. They offer free training, and Temple University has a number of legal epidemiology resources as well. Next slide. Thank you all. I can answer any questions. I think there are a few questions in the chat, but we'll go through those.
Thank you, Stacy. Thank you, Rachel, and thank you, Keegan. We do have some questions in the chat. Let me just stop screen sharing here, get back on with everyone so that we can get to questions. So we'll start with the questions in the chat. And apologies, Mark, you posed a question here. What's the title of the National Academy of Medicine publication? Not seeing anything at NAM Publications. And then Keegan did provide, for those of you who may have missed the link, it is plugged in there in case you'd like to find the Global Security Policing Workshop publication link. It's in the chat, and we'll be happy to share that following up in our email. The next question comes from Tracy McCall, who's wondering if in the data set, hospital physical security guards or officers are considered a part of law enforcement or a part of the medical team. Tracy, I went ahead and read your question out loud, and you do have the ability to unmute yourself if you'd like to engage directly with the speaker. So let me start. Keegan, can I start with you first on that one?
I will leave it actually to Stacy to talk about the data set that she referenced, but the patient examples that I gave were deliberately about or kind of deliberately sought to emphasize that there are different ways that we interact with law enforcement, that can mean different things to different populations, and that it's important that we respect that and we acknowledge that. And I think that's part of what you were suggesting, as well, is that it just because it's not the police proper doesn't mean that it's not part of a system that maybe has negatively impacting the health of a particular population.
Mhm. And Stacey?
So the APHA, their study, they looked at not only police officers, they looked at school and law enforcement. And so typically, if you are conducting a legal epi study, you can define, right? You can define the kind of the jurisdiction, if you will. If you're looking at the enforcement of de-escalation training within the police department, or you're looking at schools, whether you're looking at organizations and what type of training organizations require of their security guards, you can define your study. So we are looking specifically at police departments and de-escalation training that is required of police departments.
Awesome. Thank you, Stacey. Thank you, Keegan. There's another question and comment. Greatly appreciate what Mark just put in here. And Mark, I don't know if you want to unmute. Please feel free to do so. I'm going to read out the question for you. And I'm encouraging everyone to, since we are on Zoom, feel free to unmute let us know you have a question first. You can either use Zoom to raise your hand or pop a heads up to us into the chat. Let me go ahead and read Mark's question and comment. Are there any recommendations for how to best approach and interact with law enforcement officers and leaders? Mark, I would ask for just a little bit more definition around leaders. I'm not sure if you mean elected officials or otherwise. And then also let us know if you're from civil legal services, from a health center, from a hospital, or if you're from the healthcare side of the equation in MLP, or if you're from social services or something else. What Mark also mentions is that many of his friends in law enforcement feel misunderstood, underappreciated, and falsely accused when discussions about social justice and police brutality come up. Can definitely appreciate that, that sentiment, Mark. The panel is, as am I, we're lawyers, and so we often, we're the brunt of the jokes and not in a good way. So Mark, do you want to, thank you for unmuting, so please feel free.
Yeah, can you hear me okay?
Yes, you're fine. Go ahead.
Right, so I'm on board with everything you guys are talking about. I'm a psychologist in a federal health center, and but I've done a lot of forensic psychology work, evaluations for courts and such. So I get to know a lot of law enforcement folks, and by leadership I mean police chiefs and other leaders and civilian oversight boards and such, but also elected officials. That's a good point. I think that I'm not seeing it in this presentation because you guys haven't really touched on anything like this, but sometimes the perception that law enforcement officers have, from what they tell me, is that it's one-sided when people talk about social justice and community. Well, a lot of them are in favor of community policing, but policing reform, they feel attacked. A lot of them say, and they feel like the discussions are one-sided. So I want to make sure that we don't really have a medical legal partnership here yet. That's why I'm on this seminar and I want to learn more because I'm relatively new to this federal health center. I want to make sure that we are working in a cooperative and understanding manner with law enforcement officers so that we understand their perspective. My experience is most of them want things to be better and they don't want to shoot people and they recognize there's a problem, most of them. So just any suggestions on the attitude we take, on how we approach, on how to phrases or words to use that law enforcement will get or understand more better. I understand it's kind of a big question, but
no, it's
just want to throw it out there.
Yeah. So how do you message it, right? Because so Rachel, may I pick your brain first on this? Because with a private law firm, Kirkland and Ellis is huge, right? And going down the path of taking on any number of social justice issues, one has to think carefully about the law firm's mission, as well as messaging and what it may choose to take on, and if it aligns with that law firm, as it is in the private sector, with what your goals are. So any first stab or take on like what messaging was like, especially coming out of last year, where in the statement we saw messaging, I think, sort of disappear in the space of misunderstandings with regard to like what folks meant by defunding the police, right? When we've seen in cities like Baltimore, where I'm right now, that public health officials were the ones who really led the true meaning of reforms, and it wasn't just about defunding; it was about refunding to get public safety approaches. So, Rachel, I'm going to stop talking and actually throw that one to you first, and then Stacy and Keegan, invite you to please respond.
I think, boy, this is a good question and a tough one. I mean, I think if you look at it from an education-based approach and wanting to understand the laws and how and the messaging from a perspective of what is the message that each side is getting, and seeing where there's a delta between what people are perceiving themselves as from their own perspectives. I mean, many people, it can be hard to be outside of yourself and be in a situation and be empathetic to a situation that you've not personally experienced before. I can give you an example. I am not a person of color, clearly. I can't live those experiences. And so it can be difficult. It could be difficult. And I mean, it is difficult to understand what somebody who is not me, who has different experiences, has gone through. But I think that if we approach it in, we need to come at this with compassion, and compassion for law enforcement as a respected resource historically, and respect for human beings, and look at it there and say, where's the delta between what both of those objectives are and what we're seeing on TV, and how do we bridge that divide? And maybe what it means is, you as law enforcement, like, we're grateful for you. We appreciate that most law enforcement they're interested in improving the community, not harming it, to find out what is the delta that is creating a misperception that would cause that sort of view of the police. And so if we could look at it from a perspective of, we see a problem and we need to fix it in a holistic way, it then doesn't become, this is your fault, police officers. This is just a community problem that we're trying to address together. And we see gaps in how that's working. So let's talk about a way that we can improve education, or we can improve training, to have us look at this from a perspective of not you're doing something wrong, or not that you have bad intentions, but that if you approach it just from your perspective as a human being, that it might not come across the way that you had intended it, or you might have a perception of someone that's an incorrect one. I hope that all makes sense, but I think if we approach it with a view of mutual respect, as opposed to saying like this group of people is wrong, or this group of people, these law enforcement, they're inherently bad and we need to, fix them. But instead of approaching it like we're all, we all start with imperfect knowledge based on who we are, and like, let's buffer that and change what you understand in the way that you're coming from your position, and that we want to help with that, and we just want to make the community better, that we get to a place where it's not blaming, because I think people are and I can understand it, it's very difficult to want to be receptive to a change or to something if you're automatically, before you've necessarily even done anything wrong, feeling like you're accused of doing something wrong. Mm-hmm. So I hope that makes sense off of the cuff.
No, Rachel, I thought that was great. And I think, why are we doing this under the guise of medical legal partnerships? It's because oftentimes the default is a thing that the medical profession and legal professions don't get along. The adversarial nature of some of those interactions that the professions have takes folks into court, right? And so what medical legal partnerships do aims to achieve precisely the opposite, right? Working together, bridging those gaps to ultimately make communities, patients and clients and others safer and healthier. Let me, on that note, Stacey, you're in public health, and the aim is to look at all of the things that can make a community, the general public, safer and healthier. Would you like to add to what Rachel just noted?
Sure, I definitely agree with Rachel. We are really working in Harris County to really acknowledge past actions that have harmed BIPOC, LGBTQ, and other marginalized communities, right? And as government agencies, we have to be apologetic about these past actions because we engaged in these actions as government entities, right? And we have a responsibility to demonstrate a commitment to confronting racial justice and civil rights issues in a way that engages the community, authentically engages the community, right? And listens and develops solutions with community at the lead, right? And so that's the responsibility and the role first, is to listen and be responsive to the needs within those communities that we serve as government agencies, right? And that's the important part, remembering that we serve the communities.
Mm-hmm. I like to say often, Stacey, Keegan, and Rachel, that some of the magic of MLP is that it helps to facilitate that bi-directional communication to get over those hurdles that Mark is asking about. So, Keegan, if I can ask you, for the health centers who've been tuning into our National Center webinar, or folks without a medical legal partnership, something like a multi-state environmental scan, or even just within your state, looking at the laws that interplay with public safety, that may not be exactly what a health center or health center MLP is able to take on right now. Any recommendations as to where someone might want to start, so that at least they can bite off just as much as they can chew?
I think you start with your patients, right? That's where we started. We had 2 bad health outcomes. One resulted in kind of, avoidable medical use. And part of the goal of MLP, I think, part of what I see myself as a leader in FQs is, I got to keep people out who don't need to be out, right? Who do we need to keep them healthy so they're at home, they're not in our healthcare system. And the people who need to be in our healthcare system, we need to facilitate that. We don't need to throw up barriers when they need medical care. And so I think you start with your patients. That's where we started. There is a much larger conversation here, but at the end of the day, those are the 2 things that drove our decision to create a project around it. And then the other thing I think I would say about that is that didn't mean we had to become experts in it. That meant we had to look and take the essence of medical legal partnership, which is about collaboration. It is about unsiloing ourselves. It is about staying in our own lane, but putting that lane next to the lane of someone else who has a different expertise. And together we can build great things. And so that is so much of what I mean for the takeaway from this to be. And we're so, which is why you see the variety of attorneys reflected on this panel itself.
Mm-hmm. Agreed. There's another question in the chat. Priyanka got a question that I'm trying to scroll to here. I've got it just a moment, y'all. So Priyanka has asked, what advice would you have for someone who's not gone to law school yet and plans to, but wants to work or get involved in this work. I hope Priyanka knows that the obligatory response by all lawyers is don't go to law school, but I think we gave up on that last year. So you should go to law school, Priyanka. But what can you do now? I do believe there's a lot. Keegan, looks like you want to take that.
I will absolutely take that because one of the things that I didn't say yet is the website was actually created by a student, not a student, she's a graduate at this point, but it's a to-be student of Columbia Law School. This was a pre-law school project that she obtained a fellowship for, and we are so grateful to Angela Kang, who's one of the attendees, for all of her work on this. So can you get involved before law school? Absolutely. And yes, go to law school. Everyone should go to law school.
Yep. So Priyanka, if you go to the National Center's website, you will see that we have a map of MLPs. And if you're at all interested in finding out, who the different legal partners are that get involved in the coalition, such as Rachel, at a private law firm being involved as an MLP stakeholder, same thing for Stacy in public health. Don't hesitate to reach out, because it's not the M and the L is far more representative than just doctors and nurses, or on the other side, lawyers. Those teams are robust and diverse, with many different professions involved in these partnerships. Rachel, you unmuted, go right ahead.
Yeah, no, I was just going to say, it's probably evident towards the end of this panel, but I am super shy and I get very nervous public speaking. But I have never, and you hate hearing no, or at least I do. I'm try to be a people pleaser, but I've never, when I wanted to work with somebody on something, especially pro bono, public interest, I've never heard the word no from, hey, I'd like to help. And so the first step is identifying something that you're, feel strongly or passionately about, or you see an injustice and you're like, oh, I gotta be a part of hopefully righting this wrong. You reach out to somebody and you almost assuredly are going to hear, yes, we could use the help, and they'll figure out a way to enable you to help.
That's true. That is so very true. So we're right at time. Thank you, Rachel. Thank you, Keegan. And thank you, Stacy. So we're right at time. And I want to make sure I thank all of our guest panelists for taking time out of their schedules today to really talk about this important project that they worked on, to bring solutions to the calls to action that we especially heard at a feverish pitch last year in particular. But we know, just like the eviction crisis, right, that's playing out around the country, that these problems that we see that were laid bare by the COVID-19 crisis had long existed, and are particularly impactful in a negative way, of course, on health center populations. There are 30 million people served by health centers around the country, and too few of those are served by MLP. So I would encourage you all to continue tuning into the webinars that we're hosting here at the National Center, so you can hear from MLP practitioners like Keegan Warren Clem, Stacy Lofton, and Rachel Rezavec about the work that they're doing to really tackle those big problems that we're facing, in addition to the problems we all hope to finally get rid of, those social needs that are unaddressed. If you enjoyed today's presentation, thank you to HRSA, by the way, for sponsoring this event. Please let us know. And of course, if we can improve, still let us know. So the survey link has been placed into the chat. In that survey, by the way, we do ask a question about what additional content or resources we can provide to you here at the National Center. We'll make sure the recording for today's webinar, as well as the slide deck, goes out. And we thank you all in the audience, especially, for also joining us and tuning in. Everyone stay safe out there. Can't thank you all again enough. Get vaccinated when you can. And in the meantime, be well. All right. Thanks, everyone. Take care.